The 120-day action plan was an initiative by the Ministry of Health to spur on the development of particular and specialized programs for the complex concurrent disorder population across the age span, youth and adults.
The actions and goals in the plan included improving access particularly to acute stabilization at St. Paul's Hospital, looking at responding with some community action teams, treatment teams, some outreach teams, development of some group home beds, and some complex treatment beds.
Clients come to this program. Normally they started on the street being homeless or in a psychiatric ward. They're then referred to either Heartwood or the Burnaby Centre, where they go through a preliminary treatment of 6 to 9 months, and then they come here, and our job is to actually harden their recovery and help them move forward back to their communities.
We have some clients that say they've never felt comfortable before in past treatment, the way it was structured, that, you know, if you wind up slipping and having a relapse, then that you were booted out. We truly understand.
The role of outreach in the community for the substance using population is critical. In order to engage these individuals or these folks in treatment, often you have to meet them where they're at. And it's through that process that we are able to find them more stable housing and eventually help them find their health again. From hospital, our team and our partners help transition youth from their inpatient stays into the community, where sometimes they are housed with our partners and they continue to seek service from the Granville Youth Health Centre.
The action plan is the only reason this was possible. It needed to be the money and the will and actually the deadline to make it happen, because that brought things forward to actually go through obstacles and clean them out of the way very quickly.
The 120-day action plan, truthfully, was a call to arms. I'm very proud of what the Inner City Youth Program did in doubling its size, in adding an integrated health center and a group home in partnership with Coast Mental Health. It took a tremendous amount of work and effort to do that, and I think the outcomes speak for themselves.
So this work, while we've made great strides with the 120-day plan, it continues. It's that foundational working relationship that now helps us pave the way to looking at other areas that we need to address.
You know, you have to keep in mind that we're dealing with people that have addiction and mental health issues, and to tackle both those issues at the same time, it's quite the feat. You need understanding. With understanding, you have compassion. With compassion, you have empathy. And if you have all those three, then the chances of that person coming to their own place of wellness is that much greater.